This training is a general overview of the annual health assessment visit. These visits are provided for our managed Medicare patients. It starts with scheduling an appointment. Patient engagement will schedule all of the appointments for Medicare Advantage patients needing annual physicals. The appointment information will state AHA for annual health assessment and will include the insurance that the patient has and any forms that the insurance requires, as well as a cognitive assessment form. Again, this training is specific to the annual health assessment visit for managed Medicare plans. These include Greater Tri-City IPA, Blue Shield Promise, Molina, and Prospect. Each one of these payers has specific items that need to be documented in order for us to get reimbursed. So once patient engagement schedules the appointment, they'll work with medical records to be sure the forms that are needed are scanned into the patient's chart so they're available when the patient comes in for their AHA. The nurse or MA will be the one to print out the specific forms for that payer, and those forms will be found under categories in the patient chart. The forms have pre-populated patient information, and they will be printed along with the cognitive assessments so they're available for the clinician to use and review and complete during that visit. Completed forms then go back into the patient chart under AHA and are scanned in with the completed information by the nurse or the MA. To close the loop on these appointments, the patient engagement team will follow up on kept AHA appointments, and they will be the ones to submit those scanned, completed forms back to the correct payer. So this starts with the huddle. You're going to review the schedule together so you're aware of how many AHA visits are to be done. You can look for the forms to be sure that they're ready. You can look for gaps in care and any requirements specific to that patient. Here's an example of where to find those forms, found under categories and listed at the top under AHA forms. The RN or MA will print them, and really important, the specialty will be family medicine, and the visit type needs to be preventive medicine. The rest of the intake will be done as typically done, and that includes histories, med reconciliation, vital signs, and possibly a staying healthy assessment, a PHQ for depression screening, and the additional item in the cognitive assessment. This jumps to the end of the visit, and this is also pretty typical to complete any orders that have been submitted, such as labs and follow-up appointments and generating the patient plan, providing patient education to the patient, and important, scan the visit forms back into the patient chart. Now the clinician will do their part on the SOAP. Double check that the specialty is family practice and the visit type is preventive medicine. It's a good idea to click on the HCC link on the top just to have an idea of what kind of conditions should be addressed at this visit. Also, look for any pop-up alerts regarding capturing these HCC codes. You'll start with the reason for visit. The HPI will be Medicare Managed AHA, which will be selected under the reason for visit menu. This will launch the annual health assessment pop-up, wherein you can document review of systems using quick save is a good idea or a good way to go. Then document the exceptions for each individual patient. Review the histories. A lot of those will be updated by the nurse or MA. Be sure to select the history review button and select a detailed document for each one so this information is captured in the master IM. As always, address vitals, medications, allergies, etc., and complete a physical exam. The physical exam is another good place to create a quick save. So the forms mentioned earlier, these are important for the annual health assessment. Be sure all the required forms have been completed. Also double check, was there a staying healthy assessment done, a PHQ, all those things can be documented in the patient's chart. You're going to add to your diagnosis, and the diagnosis will be for the physical. It will be for a physical with or without complications, depending on the patient. And then also you're going to add that any HCC diagnosis code that you capture, and those will require status and plan. Then continue with any orders needed, such as referrals, diagnostic studies, follow-up appointments, etc. And now you can generate that patient's plan. Be sure to consider adding patient education or community resources to the plan for the patient as well. On the Finalize tab, you're going to calculate the code. There's no medical decision making needed. So when you calculate the code, just verify that a preventive code was selected and then submit. At some point, that note will end up in your PAQ to sign off. Here's just a reminder of the hierarchical condition category. This is what determines how much we get paid for the patient, visit. The more complex the patient, the higher the reimbursement for the patient. So when you click onto the HCC link, this is where you can easily see what things need to be addressed. So here's the actual template you will see pop up. The ones with the asterisks are the ones that have not been addressed, although you may be addressing others that may have been captured. So the ones that you're going to update from here, you would highlight and add the status, add an impression or assessment, and from your assessment, plan details. You can get more specific with that if you choose. Here's a look at some of the forms. This one is Greater Tri-City IPA. This is informational only, meant to guide the visit. This one is the exception and does not need to be scanned back into the patient chart. This is showing the HCC codes at the top. In this case, the first one has the dot next to it. This means that it's not been captured this earlier year, and that still needs to be addressed. You can see the dates to the right of it. It was addressed in 2019. For the diabetes without complication, this one has been captured, and you can see that the data to the right as well. Quality measures are listed below, and again, the dot would signify that that needs to be captured. So many of these have already been documented, but we can see, for example, the colorectal cancer screening still needs to be done. So this again is used as a guide to document in the patient chart for their health assessment. Blue Shield of California has a little bit different form. This one does need to be scanned back into the patient's chart at the end of the visit. You're going to address any HCC diagnoses. Those are listed on the form for you. Also addresses preventive screenings and early detection. The second page has additional information, including when those conditions have been addressed, and also any high-risk medications. Molina Healthcare has a form which is specific to the patient and will be found under categories and is informational only. Again, as with others, we need to address the HCC diagnosis with status and plan. After the visit, the Master IM gets forwarded to Molina. Prospective Medical has 2 pages with certain fields needing attention, including HCC diagnoses, preventive and early detection screenings documented, medication reviewed, and it's important that both pages are signed and dated by the clinician. This concludes the training video for annual healthcare visits. If you have any questions, please reach out to Lynn Hay in coding or Don Gibson in clinical informatics. Thank you for watching.